Thanks everybody for being here. I want to start with we are doing everything we can to keep customers and employees safe. Your safety and health, safety of our customers and our employees is our highest priority. I want to assure the public that the subways remain safe. That being said, if you experience symptoms like fever or respiratory issues or have compromised immunity or other serious health issues, it's good advice always to avoid large crowds. If you can get around without riding the subway, do it. If telecommuting is an option, do it. But we will be here for those who need to take the subway and buses and commuter rails and paratransit. We will get you where you need to go safely. When you do ride with us, please be mindful of your fellow New Yorkers. Since last week, we've been running public service announcements on board trains and at stations to remind everybody of best practices. Cover your mouth when you cough or sneeze, wash your hands, or use hand sanitizer after taking mass transit. Avoid touching your eyes, nose, and mouth. As you know, a week ago, we substantially increased the frequency and intensity of efforts to clean, and we're not cleaning anymore, we're disinfecting our system. The MTA's full fleet is being disinfected every 72 hours. The full fleet was done this weekend, with frequently touched surfaces and stations being sanitized daily using EPA-approved disinfectants. All stations across our system in the subways, Staten Island Railroad, Metro North and Long Island Railroad are being disinfected daily. Over the last 24 hours, 100% of stations, subways, Metro North, Long Island Railroad, and Staten Island Railway were disinfected, along with 100% of our paratransit fleet. This weekend, we've disinfected over 4,000 subway cars. That's the number that was in service this weekend. 5,300 buses, nearly 1,400 Long Island Railroad cars, and about over 1,100 Metro North cars. We're monitoring the situation closely in coordination with state and city health officials. Last week, the MTA opened a new situation room that serves as a nucleus of our response. As of last night, it's open 24 hours a day. The situation room gives us a conduit to rapidly share information with decision makers and staff on every level. It's connected with all our agencies and facilitates routine meetings among MTA leadership. Obviously, it goes without saying that we've been in constant contact with the state government and with city government. I want to reiterate that we are transportation folks, not medical experts. We will continue to follow the guidance of the CDC, State Department of Health, City Department of Health, and public health professionals. And let me turn it over to our Chief Safety Officer, Pat Warren.
Thank you, Pat. I'm going to be brief. Pat pretty much said it all, but a couple things. One is that common sense should be the watch phrase. This is in terms of being healthy, this is a situation where you should use your common sense in everything you go to, and I think everybody will be in a better place. So with that, I'll just reiterate that the risks remain low that are out there, that we, as New Yorkers and living in the metropolitan area, will likely be out and about in the public areas, and that you want to continue to do those things that will keep you safe, which is, generally speaking, good hygiene. So if you're out there touching and interacting with other people, make sure you wash your hands as you get back in. So with that, I'll turn it back to you, sir.
Thanks, Pat, and thanks, Pat. First day on the job. Obviously, we're dealing with a health crisis we all wish could have been avoided. But I think what I want folks to know about the subway and bus team is our workforce of 51,000 employees remains steadfast in their dedication to ensuring the safety of the ridership. So they are safely and efficiently moving trains and buses today, and they are cleaning and disinfecting stations, touch points, and cars and buses. And I'm grateful to be with them today and grateful to be a part of it.
The governor said if a train car is too crowded, take the next one. Do you, as a transportation professional, find that to be a practical and reasonable suggestion? And is there anything you can add to that for help riders make this decision on what is a too crowded train car?
Yeah, I think the advice of the governor and the mayor is well taken. I think the message is if there are alternatives to subways that work. If you can telecommute and that works with your company, do that. If you can bike or walk to work, which obviously there are limits to that, you ought to do that. If you can travel in the shoulder periods a little earlier, a little later in the morning, a little earlier in the evening, a little later in the evening when there's less crowding, do that. And I think the advice of the governor and the mayor on that score is, as Pat Warren suggested, based on common sense, and it ought to be followed. Andrew.
The governor disclosed that Rick Cotton has coronavirus. First of all, have you spoken with Rick? You've known him a long time. And second of all, do you have any idea how he got it?
So I don't have anything, Andrew, to add what the governor said. I did reach out to Rick after that. I personally haven't met with Rick in some time, although we talk frequently. He is a dear and valued colleague, and our thoughts and prayers are with him. And I'm sure he is certainly, by all indications, appears to be in great health, high energy level, and we're hoping that after his quarantine period, he and his colleagues will be back at the Port Authority.
But just as a quick follow-up to
Yeah.
that, from an MTA chairman standpoint, speaking with the chamber, have they given you any indication of how someone at that level would be exposed in some way?
I don't have anything to add to what the governor said. Please.
Obviously, coronavirus is a big deal, but the city council was pretty mad that there was an MTA no-show today. They said that the coronavirus preparations weren't really an excuse for it, and were saying that it made them less likely to want to fund the city's share of the capital plan that's coming up. Do you have a reason that there was a no-show and a no reschedule?
Yeah, look, we told the city council right now the coronavirus is the thing that we're focused on. The people that were going to appear at the city council hearing were mid-level financial people. We didn't think it made sense to send them when clearly the focus was going to be on the coronavirus situation. We've appeared frequently before the city council in the past. We'll appear going forward. You know, our relationship with the city is a strong one, and we expect and look forward to appearing before the council in the future. David.
Just a follow-up. You suggested that people should bike to work if they can. Is the MTA going to consider lifting the prohibition on biking across the TBTA bridges, Cross Bay, Gil Hodges, RFK, things like that?
Don't have a response on that. We'll certainly consider it. How feasible that is remains to be seen. We'll take a look at it. David.
Yeah, Pat, we've been talking about ridership now for the last week and how coronavirus is going to be impacting that. Today, I will say that my trains were much emptier than usual, and I'm wondering if you can quantify the ridership impact yet, and whether you're concerned that lower ridership will impact you at the fare box and have a long-term financial impact on the agency.
Well, look, our first priority is public health. That means if there's less crowding, as the governor and the mayor have advised, that in the short term is a good thing because it will reduce the risk to the public. Obviously, we're focused on the revenue considerations. This situation's been going on for just a week now, and we don't have meaningful data. And one of the reasons is, for instance, last Monday, when you compared last Monday of this year to its equivalent day, the equivalent day in 2019 was a snow day. So if you took last week's data, the ridership is up significantly. That doesn't reflect reality. One. Two, speaking anecdotally, I took an early train from Port Washington on the Long Island. I got on the 2 or 3 to Chamber and got on the 1. And while there seemed to be fewer people, it didn't seem dramatically lower. 3, I'll say, as we've said before, we're going to report to the board and the public next week the data that we've gotten ridership, and we're committed to doing that.
Do you think that at some point you might be requesting some sort of stimulus or funding influx from the state?
Well, look, I will echo the governor's comments. The thought of a $8 billion federal package and $35 million of it to New York State seems ludicrous to me. The MTA and its agencies will incur a significant amount of cost in this endeavor. Obviously, we're disinfecting cars, we're disinfecting stations, and I'll leave the Washington negotiating and bargaining to others, but that just seems out of whack. We will be looking for federal help and expect the delegation to help. Jose.
Hi, Pat. In terms of staffing for all this cleaning work that's being done, how well stocked are you? Are there any workers being moved around to handle these extra cleaning duties that have now been put into effect?
So let me start with this. Our workforce, as they did after 9/11, as they did after Superstorm Sandy, as they did during the Ebola crisis several years ago, is rising to the occasion. MTA forces, both represented on the Long Island Railroad, Metro North, Staten Island Railway, New York City Transit subways and buses are coming to work and doing their jobs. As I said, our first priority is the health of our customers and our employees. The workers doing the disinfecting, that is not interfering with operations at all. Obviously, we're incurring some cost, as you'd expect, but I think all of us feel incredible gratitude to the commitment of the represented and non-represented workforces. And as I said, they're doing what they did after 9/11, after Superstorm Sandy, and other events of a similar nature. Clayton.
Pat, we have it that Rick Cotton was at a transportation breakfast hosted by the Rudin Center last Thursday morning. We also have it that you were there along with a lot of other transportation professionals. Obviously, Rick Cotton now has a confirmed case of coronavirus. Have you been tested? What precautions are you taking?
So I saw Rick at the event. I didn't talk with him. I guess I came late. Didn't talk with him, shake hands. The others here who are at that breakfast are talking to medical staff here, and will act accordingly.
Hey, Pat.
Please.
Is the MTA going to ensure that Long Island Railroad and Metro North workers in particular have access to coronavirus tests if they ask for it? And is the MTA taking any special precaution with those workers?
With respect to Long Island Railroad and Metro North, look, I think the approach we're taking with the entire workforce, right, is to act in the best interests of the public health and interests of our customers and our employees. Employees at Long Island Railroad and Metro North are going to be treated with the same care as everybody else. Please.
I'll just add that our employees have instructions that if they think they have an issue, that they get a hold of their human resource experts, and then they will help them figure out what the right thing to do. So if they have any questions or worries, we have procedures in place to take care of them.
And that's true with respect to the entire workforce. Andrew.
Question for Sarah. We have video of you on the train this morning. I think it was a Q train. You're holding the pole, but you have some distance from folks. I'm just wondering what was going through your mind from your own sort of health and hygiene perspective this morning being on a train.
Honestly, that was not what I was thinking about this morning. I was, if I was on the Q train, it was extremely early in the morning, and then headed back here to the office. And anecdotally, similar to what Pat said, the trains seemed a little bit less crowded to me today than they normally do. That's not my usual commute, but the L train was quite empty this morning. But it was about 5:20 in the morning. It's pretty empty at that hour anyway. So, to the extent that people are listening to the advice of the mayor and governor and medical experts, and either telecommuting or staying home or commuting in hours when they don't typically commute, I think that makes a lot of sense to me.
Just as a quick follow-up to that, at rush hour, for those who don't have that flexibility, you're taking the Lexington line, your train is going to be packed. What are those?
No, absolutely. Look, no, absolutely. So to be clear, if you can avoid crowds, obviously you should. If you can telecommute, that's a fantastic opportunity and option for you. That's not going to work for many people. So for those who are taking buses and subways, we are here to safely and efficiently serve them, and we have people cleaning the stations, disinfecting the stations every single day, and disinfecting the cars.
And Andrew, whether you're getting on a crowded train or a train that's not so crowded, if you're sick, if you've got a fever, if you've got a compromised immune system, it's in your best interest not to get on a crowded train. And it's also not in the best interest of the system or society as a whole to make others ill. Please.
A couple weeks ago or a week or two ago, you said that the MTA is hoarding masks.
Is hoarding masks?
Yeah, I think.
No, I'm pretty sure I didn't use that word.
Oh, sorry, you had masks. I think
Yeah.
that was the word.
Yeah.
And we're hearing that those aren't as effective. Has that changed? What other precautions are you taking as we're learning more about the?
Do you want to speak to inventory?
Sure. We have a considerable inventory of masks out there, and but that's not the issue for this particular virus. What the healthcare professionals are saying, that masks are not recommended, and in some cases can be deleterious to your health. So that's the reason we're not issuing masks.
Please.
This morning, the Detective Endowment Association tweeted a picture of what looks like a homeless encampment on a number 2 train. Is there anything specific or extra that you're doing to handle the homeless population living on the trains and the subway station?
I mean, look, our homeless task force continues. So they're in the system nightly, and that work continues. And we're certainly have an eye towards health and well-being for that community, and we'll take the guidance of medical and healthcare experts.
But anything extra with coronavirus being so prevalent these days?
We'll take the advice of medical experts.
Please, in the back.
What plans does the authority? Thank you. What plans does the authority have, if any, for disclosure on financial documents like bond documents about possible material effect of this?
Yeah, look, I don't think we're a $17 billion organization. On the other hand, we're focused on minimizing every dollar of expense. We take seriously our disclosure obligations to bondholders and to underwriters, et cetera. Our CFO, I can tell you, will make sure we make every disclosure timely and fully disclose everything. I think it's fair to say that at this point there's been no material impact on the MTA. Having said that, we're trying to minimize every dollar of expense. Please.
Pat, one consideration that I've heard is that the best way to reduce overcrowding would be to run more service. A lot of lines you're not running at capacity right now. Have you guys considered putting more trains in or running more service to reduce some of these overcrowding risks?
I mean, look, we are open to that, and we'll continue to take a look at it. But I think what most people have been referring to is if they're standing on a platform and a crowded train comes through, should they get on that? Should they get on that car, or should they wait? And our advice would be many people should just use your common sense in that moment. We also don't want platforms getting overly crowded. We can run more service here and there, but generally we are very much at capacity. We've gotten questions about whether we can replace subway service with bus service. I'd say that's not an option either, but we will certainly continue to look at options that we're making sure that we're serving the commuting population and keeping people as safe as possible.
Alfonso, and then here.
Hello. So just follow up on something you've heard a lot, and I did as well. Long Island Railroad riders saying their parking lots were unusually light today. Can you tell me more about your commute coming in on the Port Washington line? Was the parking lot empty where it's usually full? What were the conditions like on the train?
So I take an early train, so the parking lot's never full. I talk to the conductor every day. He told me that it was lighter than usual, but not dramatically. My own observation was there seemed to be somewhat fewer of the regulars, right? When you take a train at 6 o'clock in the morning, you get to know folks. There was fewer people on the train, but I wouldn't say it was dramatically down. I spoke to both Phil Lang and Kathy Rinaldi right before this meeting, and they confirmed that. I think Metro North may be a little bit more impacted than the Long Island Railroad, but as I said, we'll be reporting that data to the public and the board next week. Please. Sorry, the lady in the back, I think. Yeah. Yeah, the lady in the back first.
Hi, I'm Rebecca with Pix 11. Question for you. There's been some concerns that when we talk about cleaning, that the fleets, the buses, and the boroughs aren't getting the same attention as some of the transportation methods here in Manhattan.
So can I stop you for a
Sure,
second?
yeah.
That is absolutely and categorically false, period, full stop. It's an outrageous statement. It ain't true.
Thank you.
Is there anything more you can add about this 24-hour war room? Take us through what what it has been used for, and why the decision was made to expand that.
I'm going to defer to the chief safety officer.
So the purpose of our situation room is to collect information and disseminate information rapidly so that decision makers have the information they need to make those decisions. So as information comes in about, it could be about supplies for cleaning, it could be about somebody who's ill or somebody who came back from a country, or you pick the topic, it'll come in there, and then we take that information and make sure it gets to the right people to come up with whatever the appropriate response is, and then if a decision needs to be made, then decision makers can do that.
Gentleman in the back.
Can you give us an update on how Access to Ride is being handled and their subcontractors?
Yeah, sure. So, absolutely. So, two things. One is there are 1,341 Access-a-Ride blue and white vans. They are being disinfected daily. We're doing that. It's part of the regimen, but we're also aware that many blue and white Access-a-Ride passengers are medically vulnerable, and we thought that was an appropriate thing to do. With respect to black cars and taxis, the TLC commissioner and I met last week. She issued a directive to taxis and for-hire vehicles that they be cleaned on a daily basis with an EPA approved solution. So I think that base is covered, and I thank the new taxi and limousine commissioner for taking that action.
Pat,
Dave.
so it doesn't seem like the governor of the MTA is doing anything on congestion pricing right now. Can you tell me why I'm wrong about that?
Well, believe it or not, in addition to coronavirus, we are continuing to work on both the physical construction design part of the project as well as the Washington US DOT part, and we are, the team is led by a really smart woman who worked with me at the Port Authority named Allison DiSereno. She's leading the effort here. She's a rock star, and she works it every day. Thanks, everybody.
Thank you.